My name's Julia Hagger. I'm the clinical matron based at Her Majesty's Prison in Lincoln. I do keep my training up to date, so I was able to collate all of my CPD hours without too many problems. I do attend training courses on quite a regular basis just to keep my clinical skills up to date. For my participatory CPD hours, I used some advanced clinical skills courses that I attended within the Trust. It was a two-part course and it ran over about 3 or 4 months, and that was the majority of the participatory work that I used. I approached a variety of clinicians for feedback. Due to working within the prison setting, it was deemed it wouldn't be appropriate to ask our patients for this information. I went to healthcare support workers, nurses and pharmacists within our Trust. An example of some of the feedback was from a peer related to some complex casework that I'd set up at a previous job. One of the areas that I reflected on most was related to a piece of the peer feedback. It was the setting up of a complex case meeting within the previous prison that I worked at. It was to highlight and show the patients with complex needs and how we were best to meet this. What I did with this, I had a copy of the code with me, so when I was looking at the reflective pieces, I was pulling out pieces from the code and directing that into the way I reflected on it. I found the reflective discussion really positive. It was able to go through and reflect and look at all the work that I'd done over the last 3 years. I was able to collate all that information and see how far I've come in that time. My line manager was really supportive with me, really interested in the discussion. It gave me a clear focus on what I'd achieved, and I think now it's set me up for my next appraisal on going forward, what I want to do over the next 3 years to get the next lot of planning done. My confirmer was my line manager, who's a registered mental health nurse. The confirmation was done at the same time as my reflective piece. So at the end of the reflective discussions, we sat and went through my portfolio against the NMC guidelines for confirming, and it was all done at the same time. I found it has had a really beneficial impact. It was nice to reflect over a longer period of time rather than the year's appraisal, and it's more about what you have achieved rather than what you need to do over the next period. It was nice to look at my career over the time that I've been practicing, and also how within the last 3 years my career has progressed, although still remaining with my clinical hours. I think my top tips are: don't worry too much about the process. Try as you're going along and completing training to do reflective pieces at the time so they're up to date and they're informative. Then when you come to the revalidation, you're able to reflect back on these and see if there's anything that you've adapted during that time.